In this lecture, I will be discussing ultrasound and CT of acute and chronic complications related to cesarean section. Cesarean section, at least in the United States, now accounts for approximately 1/3 of all births. Typical symptoms requiring post-operative imaging acutely would be fever with a poor response to antibiotics, dropping hemoglobin, or unexpected pain or bleeding. Acute diagnoses are a variety from relatively benign things such as small hematomas and wound infections to much more significant issues related to uterine dehiscence and possible rupture. Then there are a whole variety of more chronic related issues that are caused by cesarean section, and because of the increased incidence of cesarean section deliveries, we're seeing these much more often on ultrasound and need to be aware of them. As a result, I might add, when we do pelvic ultrasound in women, we specifically ask them if they have had a history of a cesarean section. Acute complications. The overview for this section will include the spectrum of normal after a cesarean section, hematomas, and infections. Other non-related or other related but non-GYN issues such as ureteral and bowel injuries I won't be discussing today. The choice of imaging modality, because I'm going to be discussing issues of ultrasound and CT, depends upon the clinical situation, cost, availability, contraindications, etc. And so there are a variety of different imaging modalities that can be used, including MR. My experience is predominantly with ultrasound and CT, and hence that is what will be covered in this lecture. These are images from 4 different patients who have essentially normal studies. And what might look grossly abnormal in other patients is really within the spectrum of normal after a cesarean section. So in case number 1, you can actually see the sutures from the incision of the cesarean section with some overlying skin thickening. In this situation, within the uterus, there's a little bit of slightly high density material, and that's blood in the endometrial canal, which is not unexpected. This case has a small focus of air in the endometrium, or it could be in the cervix, and a few tiny foci centrally located within a few days of surgery are also normal. This last image is a sagittal reformat of the uterus in a patient a few days after cesarean section. So the front of the patient is here and the spine is in the back. This is a nice sagittal view of the uterus. The low density region right here is where the cesarean cut was performed for the incision, and so that's a normal finding. Here, between the bladder and the anterior aspect of the uterus, is a very small hematoma. That is called a bladder flap hematoma. It's a little bit of a misnomer. It's not really in the bladder wall, but the key point here is that a small amount of hematoma in this location is just in the spectrum of normal in these type of patients. Here's CT and ultrasound of the same patient after cesarean section with similar normal findings. So a sagittal reformat shows the area where the cesarean section was made with a little bit of a hematoma, and this is the bladder. In transverse, you can see these low density areas in the part that had the incision, and notice, if you will, that the incisions are not always smack in the middle of the uterus. They may seem off to the side. Remember, the uterus was cut initially when it was quite enlarged. This is the same uterus in a transvaginal view, and the fundus is here. This is the place where the cesarean section was made, and not only can you see a little bit of fluid and low and mixed high echogenicity material in this region, but you can see in the sagittal, and even better in the transverse view, these little bright linear echoes. And this is the suture material, which you can't really appreciate on the CT scan because of the resolution. But it's quite normal at this stage to still see all the little suture material in this location, and this would not be considered an unusual finding. Small myometrial and extrauterine hematomas are shown in these 2 sagittal views after cesarean section. The fundus of the uterus is here, and there's a small echogenic hematoma in the myometrium, exactly where the incision was made, and a small component outside in the adjacent fat. Here's the bladder. So the same process. This patient was 4 days after a cesarean section that was performed because of twins in breech position, and there was also an abruption of the placenta. The patient has a fever that is not responding well to antibiotics. This is the transverse view and the sagittal reformat in this patient. First, you can notice that you can see the uterine incision. It looks rather prominent, and there is a fair amount of blood products within the uterine cavity at this point, but the incision itself is fairly routine. The canal is expanded with the complex fluid, and there's air in the subcutaneous incisions, and there's actually a little focus of air in the bladder. So these are also within the realm of normal imaging. On CT, in the immediate post-C-section patient, you can typically see the uterine discontinuity, and other common findings, which are really not important, include small amounts of air, small amounts of blood in the uterus, small parametrial collections, and small bladder flap hematomas. If they're less than 2 centimeters, they're within the range of normal. Our recommendation, and if you notice from these slides, is if you're using CT for evaluation, intravenous contrast should really be used. If for whatever reason IV contrast cannot be given to the patient, CT may not be the study of choice at that point. In addition, it is best to evaluate the uterus perpendicular to the plane of the incision, and typically that requires making sagittal and coronal reformatted views of the uterus. So it may be quite difficult to interpret what is exactly happening in the axial images that come from the source. As far as ultrasound imaging after cesarean section in the immediate postoperative period, the linear echogenic foci that are seen in the incision are the sutures, and that's a typically normal thing. There may be a mass-like area, which is a small hematoma, also common and a normal finding. Similar to the CT, small bladder flap hematomas are not uncommon, and it's fairly common to see some mixture of clot and debris with a few foci of air within the endometrial cavity. Therefore, the appearance of endometritis and a normal endometrium completely overlap, and that diagnosis should be really considered a clinical diagnosis. Our recommendation for ultrasound imaging is to use whatever variety of transducers and transducer frequencies necessary to obtain the optimal images. Remember, the uterus is still fairly large at this point, and transvaginal imaging may or may not be optimal. Transabdominal imaging will be fine often, even without a full bladder, and the woman may not be able to maintain a full bladder. You may actually be able to use a higher frequency curved transducer than usual. Now let's look at some cases in which there truly is more than just the normal findings. This patient is being imaged after an acute cesarean section because of a decreasing hemoglobin, and in this situation the hematomas are out of the spectrum of normal. In this transverse axial view, the uterus is here, and in front of it is a larger than should be bladder flap hematoma. It's about the same density as the uterus. In the sagittal view, this is the bladder. Here's the uterus with a small amount of fluid in the endometrial cavity, which nicely outlines the scar, the incision point, and you can see a little bit of the hematoma. There's also some blood within the peritoneal cavity on either side. So this would be more than normal. Sometimes these hematomas can become infected. These are images from a sonogram in such a patient who has a gas-containing collection in the bladder flap region and was having persistent pain and fever. On the transabdominal view, you can see a little bit of urine in the bladder, This is the uterus, and so sort of between the bladder and the uterus is a fairly large complex fluid collection. There are foci of air with a little bit of dirty shadowing and some other echoes within as well. On the transvaginal, it's actually a little bit harder to see the whole uterus because it was large and out of the plane, but you can see the collection with the bubbles of gas which are now rising up. The patient is lying down, and a little bit of complex fluid in the endometrial cavity.